Hey, folks, if you want early access to episodes as they drop, click that subscribe button, join us, and together we'll fix the broken U.S. healthcare system. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Kober. I am your host, and today's guest is Darrell Moon, a former hospital CEO turned healthcare reformer. After running 10 hospitals by age 30, he walked away to expose the misaligned incentives in our system. Now, as founder of Orion, he helps CEOs take back control of their healthcare spend and champions relationship-based care models like NUKA that cut costs and improve outcomes. Get ready for a candid conversation on why employers must lead the healthcare revolution. Welcome to the big show, Mr. Moon.
Ray, thank you. It's a pleasure to be with you.
Awesome. It's really my honor to have you. And so I guess I want to start with running 10 hospitals by the age of 30. You are such an underachiever, Darrell. Like, come on, man.
Let me say that a little bit. So by the age of 35, I had a goal to be a hospital administrator. Go figure. And in order to be a hospital administrator and looking at the big schools to get your MHA, I knew that I had to have experience. There was no way I was going to be let into one of these big MHA programs if I didn't have some experience under my belt. So I went to the local hospital in Provo. I was going to Brigham Young University, just started with my finance degree, and asked the assistant administrator if I could just empty the trash. It's like, just let me be here and get experience. And he actually said, no, you'd be in the way. That was the best no that I could have ever gotten. So I went up to this little community maternity hospital in a town nearby, Orem Community Hospital. I asked the administrator, hey, I want to be a hospital administrator. I want to get some experience. Is there anything I can do around the shop? And he goes, oh, this would be amazing. There's only a couple of us trying to run this hospital. We have more things to do than we have people to do it. We just bought our first IBM personal computer. We know it'll help us, but we have no idea how to implement it. You would be welcome to come on. So I had the amazing opportunity every afternoon after doing classes in the morning of going up and helping run a hospital, implementing an IBM personal computer, how to do FTE counts. And we did a hospital redesign, got to work with the architects, did a whole bunch of reconciliations, got to put stuff on Lotus 123. In fact, we built one of the very first multi-sheet budgeting systems. I had a blast.
You're dating yourself, sir. What's time? That? I said you're dating yourself, sir. What time frame are we talking about?
This would be 1983, 84.
Yeah, that's what I was thinking. So that's crazy. Could you
back when the IBM personal computer first hit the market?
Half of our audience probably can't even remember a time where personal computers weren't a thing. It's just now of course it's ubiquitous.
We all had mainframes. I mean, the hospital was running on a mainframe, and we had this big, huge computer that shot out these big green sheet, things every day, and would hand out all the sheets to the different departments. But the personal computer changed a lot, and it was fun to work with it. Anyway, so while I'm just an administrative assistant helping this guy, a couple of his people run this hospital, the state of Utah sunsetted the certificate of need law. It was the first state in the union to sunset the certificate of need law. And what that is basically a lot of this is, in order to build any new hospital beds, you have to certify that there's a need. Well, Utah became fresh territory to build hospitals. And of course, the easiest and quickest hospital to build is a psychiatric hospital. So within 2 years, 8 brand new psychiatric hospitals opened in Utah. Well, the first one was called Charter Canyon Hospital in my community, Orem. And they came to my administrator, Larry Carter, and said, will you be the administrator of this brand new hospital? And he came to me, this little, just started my finance degree kid, and said, hey, Darrell, there's only 2 corporate offices at a hospital, the CEO and the CFO controller. How would you like to come be my CFO controller? I'm like,
wow.
What? You want to give me the job that I want after I get my MHA and after I put 10 to 20 years in place? You want to give that to me now?
That's crazy.
How in the world can this possibly be? And so we opened up a brand new psychiatric hospital. At the same time, we purchased another healthcare facility. So I was running two healthcare facilities as the CFO controller, and I'm still working on my undergraduate degree.
But
And I
Darrell,
said,
so
I don't need.
Darrell, excuse me, you have to unpack that for me a little bit, because
Sure.
no one hands the keys of the kingdom to some 20-something-year-old kid who basically expresses an interest.
5-year-old
yeah,
kid.
there has
He
to
hands me the keys to the kingdom.
so there has to be some type of an epiphany. You must have exhibited something extraordinary to this man for you to have that opportunity. So and you just need you to kind of connect the dots for me there.
Yeah, there's no question. I had so much fun every afternoon doing all the projects that I was given. I was on fire. So yeah, there's no question.
You were.
I was having more fun doing it than I had learning about finances. And I'm like, I don't need to go get an MHA from some big school. I got the job I want. I just need the card that says I have a Master of Health Administration.
Right.
And it just so happened that Brigham Young University at the exact same time opened up their first MHA program. And they offered it on an executive style. So I could take classes in the evenings. I'm like, sign me up. So while I'm running those two hospitals, I'm getting my MHA. As soon as I finished that, the regional CFO vice president came to me and said, hey, we're opening up another brand new hospital in San Diego. Your wife's from San Diego. You're finishing your degree. You got your MHA. How would you like to come open up another brand new hospital?
Wow.
Like, sounds good. My wife would love to live in San Diego.
Right. Who wouldn't love to live in San Diego?
Exactly.
Amazing.
So I started to become very disillusioned just with the ethics of the company.
Okay.
Didn't feel like the things they were asking me to do were like proper. And so I went back to the same Larry Carter, who had at this point now left Charter and gone to work for Hospital Corporation of America and had gone to Houston to run one of their big hospitals. And I said, Larry, tell me about the Frists. Tell me about HCA. He goes, Darrell, I really enjoy working for HCA. He said, let me get you an interview in Nashville. I went to Nashville, had an interview, and landed a hospital assistant administrator position in the Dallas-Fort Worth area. And while I was there, I had the opportunity to run two hospitals in Texas as an interim administrator as they were going through some transitions. And then they came to me and they said, hey, we're opening up another brand new hospital in Aiken, South Carolina, on the beautiful campus of Aiken Medical Center. It was a psychiatric hospital. They said, look, you've already opened up two brand new hospitals. How would you like to come open up another one as the administrator? I'm like, great. Aiken, South Carolina has got to be one of the most charming towns in America, and opened up probably one of the very last psychiatric hospitals that HCA opened. Enjoyed that, and then had an opportunity. And it was during this time that I started to become just disillusioned with this whole healthcare industry.
So, Darrell, these are all psychiatric hospitals to this point?
So the one in Orem was Med-Surg. When I went to Aiken, I was actually in two roles. I was the assistant administrator of the medical center, and I was the administrator of the new psychiatric hospital.
Okay.
So that was a dual opportunity while I was in Aiken.
And so tell me, can you give us an example of something that was an expectation or something that they asked you to do that you were not comfortable with?
Well, when you are a for-profit hospital and you run from quarter to quarter, and the quarter reports are incredibly important for the shareholders, they came to me, the CFO, and said, hey, have you given us all your accruals? Well, in accounting, you accrue for expected things, right? Mm-hmm. And in the accounting world, it's not uncommon for you to, pack your accruals from one quarter to another or release them. And they came to me and they said, give us all your accruals. And I said, I've already given you all my accruals. The only accrual left on my books is the payroll accrual. I'm like, I'm not giving you my payroll accrual. Well, I get a call later that afternoon from some senior guy in the company saying, I understand you've got accruals you haven't given us. I'm like, okay, I'm done. This is not right. This is
Right.
so much of a game. I'm going someplace else. So the one thing that Larry said, and I found with the FRIST, was every time you got together with all the other hospital administrators at a big meeting in Nashville or wherever, Tommy Frist was always about, if you ever get asked to do anything you're uncomfortable with, here's my phone number, you call me. And that gave me a huge amount of just, okay, I can work for this guy.
Right.
You know, if senior accounting calls me and says, look, I want you to pad the books or whatever, I can call Tommy Frist and say, you know what? I don't think this is right.
Yep.
So I enjoyed working for the Frist. In fact, most of the hospitals I ran were for HCA.
Got it.
But I was passionate about Deming. You familiar with Edwards Deming and the whole continuous quality improvement effort movement?
Why don't you educate us?
So he's the grandfather of the Net Promoter Score, the Google 5-star ratings, total quality management, Six Sigma, Kaizen, the total quality management movement. He's the grandfather of it all. And way back, back at the turn of the century, he went to Ford and General Motors and said, look, I've got some principles of continuous improvement that I think you should apply. And he said, nah, we're not interested. So guess where he went?
General Electric.
Japan.
Japan.
And you know the rest of the story.
Yeah.
He taught Honda and Toyota how to build cars that the customer wanted. So Deming teaches, he's got 14 points, but I like to break it down into 4 easy to remember simple principles. You define who the customer is. And that's incredibly important because there's lots of different customers for an organization. You got to be clear which customer are you talking about. Once you define the customer, figure out what the customer wants. What's going to delight, inspire, engage, motivate the customer? What's going to bring the customer back? And then you simply identify the processes that most impact delighting the customer, and you measure those processes. And when you find variance, you get the people closer to the process to improve the process. That's Deming. Well, back in the 80s and 90s, while I was running hospitals, the Joint Commission on the Accreditation of Healthcare Organizations, Joint Commission, which you probably heard of before, all hospitals bow to Joint Commission because you have to be accredited, and preferably accredited with a commendation in order to bill any insurance company. The insurance companies basically take Joint Commission's accreditation as the accreditation that's important. Even the government says, you don't have to be Medicare approved, you just have to be Joint Commission approved. Well, Joint Commission implemented Deming's principles and said to their accreditation standards, we're changing. And that had a huge impact, and it was an impact for good because prior to Joint Commission, when Joint Commission came, before those changes to those principles of total quality management, Joint Commission would come in and it was like surveying a bakery and looking to see if the recipes were up to date. Were all the policies recently signed off by the board? They would look to see if the temperature of the refrigerators got up to a certain level and that they were being, that they were being monitored. Is the bakery oven getting hot enough to cook the bread? But they never tasted the bread. And so Joint Commission implemented Deming to say, we need to start tasting the bread. We need to start seeing whether the actual services offered by the hospital are good services. And so here I am going from hospital to hospital. And one of the things that I was really good at was helping hospitals become accredited with accommodation using these new principles. So I was very steeped in Deming. And it was very difficult not to step back and look at the entire healthcare industry through those lenses of Deming and say to myself, who's the customer? Because that's what Deming says first. You find out who the customer is. Well, if you really step back and look at this entire industry, biggest industry in America now, who's the customer? It's not the patients. It's not the doctors. And that was my primary customer because it's like nobody can admit to a hospital except for the doctors. So I spent all my time recruiting doctors. It's not the insurance companies. They just pass money on. The real true buyer of healthcare is employers. Bottom line, CEOs purchase healthcare. And I couldn't help but think to myself,
Well, so
If the
let
CEO,
me stop you there though. So I agree with that in principle. The buyer is the employer, but isn't the ultimate customer the patient?
well, when you define a customer, you define who's being served, who are the servers, who are the senders, and then I like to think of solvency within a company as a customer. All four of those customers have to be well balanced.
Mm.
Well, in healthcare, there's no question that the patient is served by the hospital staff. But who sends the business to the hospital? Who pays for the healthcare for the patient to be served?
Hmm.
It's the CEO. Patients pay a very small percent of the total bill. So it truly, if you look at the largest, most impactful purchaser of healthcare, it's Uncle Sam and CEOs.
Mm, for
Of
sure.
course, Uncle Sam is really just people who represent the public. But I
Well,
couldn't help but think,
yeah, and the CEOs
how is it?
represent more than all of Uncle Sam's,
Yeah,
population combined, right? So
yeah.
it's private enterprise, or enterprise period that drives
Yeah.
the healthcare system by far.
Yeah. So here I am, top of the food chain, running hospitals, and I couldn't help but think, why in the world would a business leader like a CEO who's supposed to be my customer allow me to scheme every day to work against them? Because my entire job was to work against my customer.
Mm,
I spent my entire day, all my incentives, all my bonuses, all my rewards were based on keeping my hospital full.
mm.
Now, what CEO wants the largest vendor of the second largest cost of doing business spending all their time scheming how to fill up their hospital beds?
Hmm.
And I couldn't help but think, how does this happen? How in the world can the largest industry in America get away without working for their customer? And that bothered me for a long time. Texas, South Carolina, Illinois. I'm like, there's got to be something wrong. What is happening to this industry to allow for this? I mean, let's put this in perspective. 60 years ago, only 6% of the population had a chronic condition. Now 60% have a chronic condition. We're not creating health. Hospitals and healthcare is not built to create health.
Mm.
40 years ago, our country's gross domestic product was 20% manufacturing and 8% healthcare. Now it's switched. Our
Yeah.
country only produces 8% manufacturing and almost 20% healthcare. It's like, how is this happening? What's going wrong?
The answer
with
is money.
this
What's the
system?
question? Yeah.
And I couldn't help but think, I can no longer spend the next, 30 years of my career dedicated to an industry that is not serving the customer.
I think it's
And so
remarkable
I
that
left the treatment
at
site.
an early age, you had the wherewithal to even ask the question, right? Because here you are, a young man that is charged with running multiple hospital systems, and you had kind of the wherewithal to say, this isn't right. If I'm focused on the customer and the customer is the employer and the employer is not being served, why is the employer tolerating this? As opposed to just
Yeah.
saying, well, why, if it ain't broke, don't fix it. It's working for me. My hospitals are doing well. Let's
Making lots of money.
making lots of money. Like, why would that thought even enter your head?
Right. Well, I was very passionate about Deming and this whole idea of total quality management.
Wow.
And I could see what was happening to healthcare costs. And it's like, I cannot dedicate my career, not that hospital administrators are bad people,
Mm-hmm.
because they're all caught up in the same system. It's really the buyer who's not holding anybody accountable that I fault for this.
Well,
And so
Darrell,
I have spent the last
I don't know if
30
I don't know if
years.
you've read The Great American Healthcare Heist yet by Chris Deacon, but some hospital administrators are bad people. I'll just leave it at that.
There's no question. In all of the healthcare industry, there are lots of bad people, but there's a lot of good people that are caught up in industry
Yeah.
that is not being held accountable.
Agreed.
So I've spent the last 30 years focused on raising the awareness amongst business leaders to what it is they're doing and why in the world are they allowing this to happen. And the truth is that business leaders hate the topic of healthcare. I spent the last 12 years being the top speaker to CEOs across the country, to the largest CEO coaching organization in the country. And I have gotten in front of over 1,000 CEOs.
And the name of that organization is Vistage?
Vistage.
Vistage, yeah. And so I know where you're going with this, and I'm really kind of sitting on the edge of my seat to understand the why, because it just boggles my mind. If healthcare is most often the biggest expense after payroll, and for you to have a conversation or give a talk to executive leadership and show them that they're hemorrhaging money, that really it would better serve their organization if it were dropping to the bottom line. Why don't they give a shit?
That is exactly why I like to get in front of groups of CEOs. And I get 4 hours to literally take the covers off the healthcare system and show them that they're being literally blinded. And I love to ask them the question, why do you do it? Why in the world are you willing to spend the second largest cost of doing business on healthcare? And they look at me, and you know what they always say first? Because I have to. And I ask them, what in the world do you mean by that? Well, isn't there a penalty if we don't? And I'm like, oh, give me a break. The penalty is a sixth of the cost of what you're spending. So don't tell me you're avoiding a penalty by spending 600% more money so you don't have to pay a penalty. So that's not the reason you're doing this. So Don't tell me it's to avoid a penalty. And it isn't until they really start to think about it and they really start to ask themselves the question, what does it really mean when I think I have to? Well, what it always boils down to is I can't attract and retain top talent if I don't offer benefits at least as good as everybody else. And that's good enough for most of them. It's like, as long as I offer benefits, I can go out there, I cross that T, I dot that I, and I can go get the best talent I can find. And then I ask them, okay, so loyalty is why you buy healthcare. Yes. Okay. Was Peter Drucker right? That which gets measured gets managed. And they're all like, well, of course. Do you all have KPIs? Do you all have your dashboards? Absolutely. Do you spend time almost every day looking at them? Absolutely. Okay. How many of you are measuring to see how well the second largest cost of doing business is working to create loyalty within your company? And guess how many CEOs say that they even measure that? Zero.
That would have been my guess.
And I'm like,
Yeah.
Can you see where the problem lies? You say you want loyalty, but you're not even willing to measure to see if it's working. And then I ask them, okay, so if you were to survey that and that's what you want and you see whether it's working, are you willing to incentivize the people inside your company who are in charge of this expense to create more loyalty? Does HR, do the benefits managers get any kind of an incentive or bonus to improve your loyalty scores? No, never once. And then I ask them the key question. So what does your HR and benefits manager do to buy benefits? Well, they go get a broker. They go get a benefits consultant. And then I ask them, okay, does that benefit consultant do better when you do better? Are their bonuses tied to your loyalty scores? No. Well, then how are they getting paid? Well, they're getting paid by, I guess, the insurance company. So you're telling me that you're okay with incentivizing them to see your costs go up. And they look at me like the light bulb just went off. Oh, well, how do we fix that? Business 101, measure to see if the cost is working. How hard would it be to ask your employees to see whether or not your benefits package had any impact at all when they came to work to recruit them? And now that they're here, every day they choose to stay with you, ask them how well your benefits that you're spending money on are even working to keep them. That's not a hard question to ask.
Right.
And yet they never do. Now start asking and now start bonusing your benefit consultant and your HR based on how well those scores go up. That's not a hard thing to do.
So wait,
It's like you give your salespeople a
they don't
bonus.
have to spend $500,000 to hire a high price consulting firm to do this study. Well, it's got to be.
This is like a survey monkey question.
It's got to be useless then. Well, you can't put any credence in that. It didn't cost us $500,000.
I know. So, I mean, it really, that to me is the biggest fumble in America. The fact that the buyer, the customer of the largest industry does absolutely nothing to hold the system accountable, is not incentivizing or rewarding anybody to be aligned with them, is why the broker consultant community continues to do what they're doing. Trend is their friend. That's why the insurance companies keep doing what they do. It's like the more that costs go up, the higher their shareholder value. The more that hospitals stay full, the more that doctors do, the more that pharmaceuticals are purchased. Everybody in the system is running amok because the buyer does absolutely nothing to hold the system accountable, to align the system to work for them. That's why the book I recently published is called Make Healthcare Work for You, for goodness sakes. Like, you make everything else work for you. Why in the world don't you make healthcare work for you?
And that's available on Amazon, I would imagine.
Yes.
Okay. Yeah. Excellent. So we'll put a link in the show notes to that. But that sounds like a great read. And so this was published earlier this year. What kind of feedback have you gotten from the book?
It's been great. It's been really fun to have some of my very good friends and leaders in the healthcare innovation industry give me 5-star reviews and put some great comments. So it's been excellent.
Yeah,
and I'm using it now to open the eyes of CEOs. So, I really got inspired 6 years ago when I learned about NUKA, the best healthcare system in the world. And that's really what got me to say, okay, it's time to write the book. I need to share with the world that there is a major organization in this country that has cracked healthcare. Much better healthcare at half the price.
And NUKA is an acronym?
It's not. It's a word in Alaska language called NUKA, NUKA, which means something big and beautiful and strong and something that actually, is significant. So they built the best healthcare system in the world, and they simply call it the NUKA System of Care.
Huh. And so that really caught your attention. What about it caught your attention?
Well, Stacy Richter, good friend of mine.
I know Stacy. We've had her on.
Relentless. Yep. She's actually Norwegian.
That's a lie. I didn't have Stacy Richter on. Stacy's a podcast host.
Yes.
Also in the healthcare front. Continue.
Yes.
Yep.
So she put out a recording of a podcast done in Norway, in Norwegian. The first few minutes are in Norwegian. And it was a host interviewing the medical director of the NUKA System of Care. And after 2 or 3 minutes of being in Norwegian, it all converts over to English. And so she put this podcast out. And I sat there listening for an hour and a half to the medical director of the best healthcare system in the world describe a very different healthcare system than what we have in this country. And learn that new, better healthcare system gets the highest quality of care, the best population health improvement, the best customer satisfaction at half the price, and has been recognized internationally and nationally as the best healthcare system in the world. I'm like, why don't I know about this? This is crazy. And I actually went to them and said, look, you guys put on a conference every year, and countries from all over the world come to your conference to learn how to build the best healthcare system in the world, the best model, the aspirational healthcare model. I said, does anybody ever come up from the lower 48? They said, yeah, no, not very often. I'm like, okay, that's a problem. That is an underline as to what's wrong in America. The best healthcare system is right here in America, and nobody knows about it. I don't even know about it. So I have spent the last 6 years, literally every chance I can, to share their story and show that healthcare has been hacked. Healthcare can cost half as much, can be far better, light years ahead of better. And it's very different than what we see every day in the American healthcare system. And it's not the hospitals that are going to make the change. It's the customer, the business leaders that have and get to make the change and can make the change.
Part of the problem, Darrell, is that, drawing kind of a Native American parallel, first of all, they traditionally, historically, are not the healthiest population if they're running
Oh,
casinos and
worst
stuff like
population
that,
health in the world.
right?
Yeah.
So then we talk about, the casinos and what I like to call the healthcare casino, because, and why do I use that reference? Because the whole idea and concept of a casino is to get people in to a rig game where the house has an edge and an advantage, and to lull them into thinking that they're not actually gambling with money, they're gambling with chips. And in the
Yeah.
same way, in healthcare,
Yeah.
people
It's
don't
very
know the
good parallel.
cost of the price of admission. They know what
Yeah.
their share of the expense is when it comes to the premium. But if they understood that, according to the Kaiser Family Foundation, that the average cost is approximately $17,000 per employee per year, and national average for family coverage exceeds $34,000 per year, people's heads would explode because no
Yeah.
one is paying attention to that. And then
Nope.
when we look at the high deductible plans and the HSAs, et cetera, and we're expecting people to pony up $3,000, $5,000 plus in terms of their deductible, they don't have it. So,
Yeah.
that is just kind of a tip of the iceberg glimpse on what's wrong. So it's fascinating to me that this NUKA system, according to you, is like this epiphany. So we're dealing with a population that historically does not have great health, and yet they managed to turn the corner on it. So I'm really fascinated for you to share with our listeners and our viewers what exactly
How that
this
happened.
is. Yeah.
That's such an amazing story. So, when the federal government in the United States stole the lands of indigenous people across this country, they gave them in return free health care in perpetuity. Well, back in the 80s, the federal government finally acknowledged that the health care they provide all the indigenous tribes across this country is terrible healthcare. The federal Indian healthcare system is atrocious. And they recognized that. And they sent out word to all the tribes, if anyone wants to build their own healthcare system, we will divert the money we're sending to the federal and healthcare system to you. And this group of 190 Alaskan Native tribes called the South Central Foundation said, we can't make this any worse than it already is. We literally have the worst population health in the world. Our population health scores are the worst in the world. And we have the worst healthcare system in the world. We can't make this any worse than it is. Let's go ahead and take the federal government up on their offer. And they did something that nobody else had ever done before. They applied the Edwards-Deming principles of asking the customer what's going to delight them. They went out to their 70,000 people and they said, what do you want from a healthcare system? Mind-blowing change paradigm from the way we normally build healthcare. The way we build healthcare is this miraculous body, this organism called the body, most miraculous in the universe. It's really complicated. And so people go to school for 7, 8, 10 years to learn a specific element of it. And then they put up a shingle and they say, look, I'm the expert now. Come be the benefactor of my great wisdom. Learn from all my education. And that's how we build healthcare. Well, this group in Alaska said, what if we were to ask the customers what they want from healthcare? And they did. And what the customer said was, we don't want a paternalistic system that just tells us what to do. What we want is a healthcare system that's a guest at our table, that journeys with us on our path of life, and that actually supports us in reaching our goals, dreams, and aspirations in life.
What a
If
novel
you
idea.
ask somebody what good health means to them, the most common answer is just being able to do the things I want to do, not letting my health get in the way. That is what the definition of good health is. And they basically said, that's what we want healthcare system to do, is to help us create health so that we can accomplish our aspirations in life. And so they called it an aspirational model. And they went about building a model of healthcare that looks very different than what we're used to. They went out and said, we're going to build a team. They call it a massively powerful primary care system based on relationship, wrapped around the customer, and very behavioral focused. So they took their 70,000 members, divided them up into about 70 teams of a primary care provider, a nurse case manager, a medical assistant, and a support person. They said to those 4 people, you're going to be surrounded and supported by immense ancillary services, all the radiology and all of the behavioral and all of the social and all of the pharmaceutical and all the physical therapy and all these amazing ancillary services. But your job, the 4 of you, your primary job is not to be a doctor. Your primary job is not to be a nurse. Your primary job is to get in relationship with every one of your 1,000 members. You are to be their friend. You are to be their coach. You are to be their cheerleader. You are to be a guest at their table, to partner with them on their path of life, helping them reach their aspirations in life. And when they fall down and when they need healthcare treatment, they have access to you that they already trust to get access to immediate, perfect care, coordinated at every level by people they know and trust. And built from that point on, now 30 years later, the only healthcare system that's won the president's prestigious Malcolm Baldrige Award for Quality twice.
Wow.
And around the world, they're recognized as a light years ahead of every other model in the world. It's like everybody needs to hear about this model.
So I'm not sure
everybody
if you know,
asking
but
for
who is there? Is there someone that really was the champion of this? Was there a leader that really kind of deserves credit for taking this leap? Because I'd love to give that person a shout out if you know who they are.
Catherine Gottlieb was the CEO of the South Central Foundation. She's a Native Alaskan person who was the leading charge, but she'll be the very first person. She's no longer the CEO, April Kyle is, but all of them will be the very first people to tell you that this was the Alaskan Native people that did this. They do not take credit for any one particular person. In fact, the medical director, Dr. Eby, a very good friend of mine, he's the one I heard talk about this. He will be the first one to excuse himself entirely of any credit for this amazing system, even though he played an immense role in the development of it. And he will say this was built by the Alaskan Native people who, by the way, make all their decisions based on what's going to be the best thing for the next 8th generation.
Wow.
Their culture is built around what are we going to build today that's going to benefit our great grandkids.
That's amazing.
We don't do that.
What's striking is it's so simplistic. Just ask the question and then wait for it. Listen, right?
And then build it based on what they said they want.
And then build it based on what they said they want. Amazing.
It is amazing.
And the results are just.
You can't compare them to anybody else. They've moved their entire population from what used to be in the low 5% of all population health HEDIS scores. They're now in the top 75 and in many cases over 90% across their entire population of all those population health scores. Their customer satisfaction is 98%. Wow. They've moved from only having 3% of their 3,000 staff being Alaska Native to now 60% of their 3,000 staff are Alaska Native people. They're just such a beacon of hope for this broken healthcare system in America. Imagine if we could do the same thing across this country, and instead of spending $5 trillion on healthcare, we could spend 2.5. That 2.5 trillion of waste in the American healthcare system, proven by the NUKA System of Care, is bigger than the entire gross domestic product of Russia.
Yeah.
We waste every year more money than the entire gross domestic product of Russia.
Episode of Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket costs for healthcare. Visit benefixa.com today. It's remarkable because what you're describing is a system where really I don't think there's any medical practitioner that would argue the reason that they got into business is to care for people. And so we've evolved into a system that is a beast that we have to feed, that is driven by all of these nefarious players that whether they're hanging out a shingle that says nonprofit or for-profit is irrelevant. They're all driven to make money at the expense of the policyholder, of the patient, of the member. And we are feeding into this system so that their bottom line is what drives the direction of care. And what you're describing is the antithesis of that. It is the exact opposite of that. It is now patients and members having a champion who's guiding their care, and everything is based on what is best for the patient. It almost sounds like it's too good to be true. It's fantasy, impossible that this is a fairy tale. And, you could come clean now with the audience, Darrell. Like, the jig is up. Like, this isn't really happening.
I would encourage everybody and anybody in any element of the healthcare system to go to Alaska and attend their 5-day conference. You will be blown away. And here's the part that is so amazing. They have proven that relationship trumps science when it comes to healthcare. And they understand how important relationship is, to the point that if you attend their 5-day conference, you get to spend the first full 3 days going through the very same, what they call core concepts training, that everyone who joins the NUKA system as an employee or a doctor or a nurse goes through, and then gets regular repeated training on. And it's a 3-day training on how to build a relationship with someone else where they're willing to share their story. And then the most important part is when they're willing to open up and share their personal story, it's how you respond to that story that makes all the difference in the world at building trust. You don't ask a lot of questions. You don't argue any points. You don't tell them that they're thinking wrong. You just simply say, thank you for sharing that story. That is such a powerful principle to build trust, that every one of their 3,000 people in their system are trained in that, are retrained in that. And that's how they run healthcare, is to build relationships of trust. Whether you're the housekeeper at the hospital or whether you're the doctor at the primary care that's going out to visit people in their homes. It's about building relationships of trust so that people will share their aspirations, so you can then build a treatment plan to help them reach their aspirations. Can I take a minute to talk about, when you talk about the nefarious designs of people within the healthcare system, can I get into a little bit of detail with that?
Yeah, please. I would appreciate that.
As a hospital administrator, the system is built by design to fill hospital beds. I'll tell you about an experience I had about 1.5 years ago, maybe about 2 years now. BYU every year puts on a really great conference for healthcare leaders across the country. And I attended that conference a couple of years ago, and somebody from Providence Healthcare System put up on the board a display showing Providence-owned primary care, Providence-owned specialty clinics, and Providence-owned hospitals, surgical centers, and imaging centers. And there were 2 very small red dollar signs above the first box, and 2 very small red dollar signs above the second box, and 2 very large green dollar signs above the hospitals, ambulatory surgical centers, and imaging centers. And basically his comment was, Providence doesn't make any money in primary care, doesn't make any money in specialty care, but they make a lot of money over here in the hospital. And the arrows were, our preferred referral pattern is to go from primary care to specialty into the hospital. And I'm like, oh my gosh, I can't believe somebody's willing to put that on the board. We all know that, but nobody's willing to admit it.
Right.
And he's putting it on the board. And his whole point to these healthcare leaders across the country was, he put up another slide, Amazon buys One Medical. He said, we are losing control. I call it the beast. I call primary care the head of the dragon. We are losing control of the funnel source. When we lose control of the funnel source, we are not going to be able to fill up the hospitals. We're not going to be able to make our money. We need to change the way we do healthcare. And his comment was amazing. He said, hospitals should compete based on cost and quality. Like, yes, that's what the buyer of healthcare should be forcing the healthcare system to do, instead of buying a plan that has a network where 95% of all the primary care providers in the network are the front door of the beast. Everybody you can go to that's in network is owned by the hospital systems. And we, the hospital systems, by design, require every primary care provider to reach so many relative value units every single day. If you don't hit your 30 or 40, standard that we're going to cut your salary. You're not going to get your bonuses. And so every doctor at the front end of healthcare, instead of building relationships with people, are trying to make sure they hit their 40 RVUs, procedures, visits, tests, in order to meet their requirements for their salary. They hate it.
Right.
They don't like it.
And
They
so,
don't like the
folks,
fact that they can't spend the time with the patient.
What Darrell is talking about are relative value units, and most folks are unaware. But the system has turned our doctors into glorified salespeople, and when they drive revenue within the health system that they're a part of, then they earn credits. They earn these relative value units, and they're under immense pressure to drive revenue within the system, and their very livelihoods are dependent upon it. And it's probably one of the reasons why suicide rates are as high as they are. One of the highest in the medical profession are doctors, and it's all because of the stress and the weight that the system is putting upon them. It's just unbelievably taxing and toxic, and that is the system that you're describing. So I'm curious. I don't want to bust your flow, but I want to back up a little bit because it ties into what you're talking about here. And so I have experience in the Alaskan market. I co-consulted on a case with David Contorno, and we had a good-sized regional airline that was based in Anchorage. And one of our challenges, so we actually have a case study on our website. They came in, they were with Premier, Blue Cross, Blue Shield, spending approximately $2.5 to $3 million a year on coverage. They had no cost containment, no control. They were just kind of, to your point, feeding the beast. And the CEO was someone who really listened, and he listened to what David and I had to say about, you're doing it wrong, and there is another way to go about this. And so with our help, we managed to cut costs in half in the first year that we did business with them. And it wasn't without a leap of faith. The CEO, Rob McKinney, went on record. He was a guest on my podcast, and he said, "Look, that was one of the hardest decisions I've ever had to make as CEO because you have people's lives in your hands, literally." And we delivered for Rob, and I'm forever grateful to him for taking a leap of faith and for putting his trust in us. And what I'm more proud of is the fact that we were able to deliver for his people. But it begs the question, Alaska is very cut off. It's remote, it's huge, it's vast, but there aren't a lot of options for medical care. And one of the challenges that we ran into was when you're dealing with the hospitals that are there, they are very monopolistic in their practices. And so there's no reason for them to take a discount off of sticker price because you want to pay, X percentage over Medicare. Yeah, there's no competition. So, and I don't know if you know the answer to this, but the NUKA system sounds like it is a dream healthcare system. How did they manage to navigate such a tight market? Because for our listeners and our viewers, this is a big question that they have. A lot of folks, a lot of businesses, a lot of organizations operate in markets that are similar to Alaska in that there are a few players in the game, and their fear is if we don't have access to this hospital, we're kind of screwed. So can you shed any light on that for us?
I can, and I would love to. So one thing you have to understand is that the NUKA system is an entirely enclosed system. They own their hospital, they own their specialists, and they own their primary care providers. So they do not use the local hospitals. They have their own system. In fact, they've rebuilt their entire hospital from the ground up. It is amazing. And the only ones who have access to it are Native Americans that are a part of the tribe. You can't get access to their system. Even if you work for NUKA, you can't get healthcare from NUKA. About the only exception is if you are the president of the United States and you're traveling in Anchorage and you need healthcare, you can go to NUKA. Other than that, vice president, you don't get it.
Right.
So, and we could go into all the detail about how they manage healthcare for not only the people in Anchorage. the tribal people in Anchorage, but all the healthcare for all those little tiny tribes and all those little tiny communities spread all across the southern end of Alaska.
Mhm.
We could go into all kinds of details to how they do that. It's pretty amazing. But the point is, you're right. When you can't compete, or when you can't, pit one hospital against the other for a better price, how do you build healthcare that's going to save money? And I believe there's 3 pillars of the architecture that is incredibly important on how to build healthcare. And we'll start with the one you're asking about, which is when someone needs healthcare beyond primary care. Because we can talk all about how do you align subscription-based primary care, or DPC, with the members. But let's say someone needs a specialist. Let's say someone needs a hospital. Well, historically, we have not had access to who does good care. It's like you ask your neighbor, who did your knee replacement? Oh, Dr. John. He did a great job. Okay, well, I want Dr. John. Is Dr. John on my network? I still want it. It's like, why? Because my neighbor had his knee surgery done by him and he liked it. It's like that. That's pretty much what people use to determine who's the best provider.
So silly.
Well, now that we have access to real data that not only talks about customer satisfaction, but outcomes, but also appropriateness of care. When you if you really pull the covers off and you look for the doctors who really do outstanding job, forget about what they charge. If you just send everybody to the best doctors, you're going to have the fewest complications and you're going to spend less money. I'll give you a couple examples. So a few months ago, I have access to that data. And one of my board members said, hey, my wife's got to have shoulder surgery. Will you tell me who the best doctor in the Utah market is to replace a shoulder? So we looked. Sure enough, we found one. They went, had a marvelous experience. I was headed out to Akron, Ohio in a few weeks to do a presentation to a bunch of CEOs. And I said, I'm going to do the same thing in Akron. I'm going to look to see who's the best orthopedic surgeon that I would send a family member for a complete shoulder surgery. I could not find in all of Akron, Ohio, an orthopedic surgeon that I would recommend to a family member. So I went up north to Cleveland, about an hour away. Now, what is Cleveland known for? The Cleveland Clinic.
Yeah.
I could not find in all of Cleveland an orthopedic surgeon that would do a shoulder surgery that I would send a family member to.
Yeah, I'm not surprised.
And yet you would think that, oh, I'm going to go to the Cleveland Clinic. I'm going to the best place in the world. I could not find a single orthopedic surgeon in all of Cleveland, in the clinic or outside the clinic, that I would send a family member. I had to go to Columbus, Ohio, to find an orthopedic surgeon that scored well on appropriateness, on outcomes and satisfaction that I would send a family member to.
Let me pause you on that. Let me pause you on that for just a second, because I think it's an important message for the audience, in that hospitals typically do a wonderful job in marketing and advertising. It doesn't make them the master of all things, though. And some hospitals have specialties that they do very well, and they have other specialties that they don't do very well. And in a typical system where you're forced into choosing a doctor based on geography or what hospital they're affiliated with, you could, and often people do, choose wrong. And so it's really important.
And
it's really a great lesson, I think.
That idea of who's in the network, that I think is one of the biggest black boxes that we've pulled the wool over the eyes of business leaders, is that, oh, you have to have this Aetna network or this Cigna network. Well, baloney. One of the things hospitals love, I don't care if you're in Anchorage or Akron or Utah, hospitals love cash.
Right.
And if I go find who the best doctor and who the best hospital is to get a procedure, and I simply walk in and say, I'm going to pay cash up front, there are very few exceptions where that hospital is not going to take your money.
True.
So, the idea that you have to get a network because you've used your purchasing power to get the best pricing, oh my gosh, that is such a baloney. You go to now any hospital that has to put their charge master, their fee schedule online, and you take a look at their contracts, and you will find that some of the largest employers or the largest insurance companies are getting a 10 to 15% discount, where some of the smallest ones are getting an 85% discount. It is such a
scam.
It is a scam.
It's a scam.
It's like all we have to do is wake up business leaders and show them that, but when you need to purchase expensive healthcare, you do it based on who does the best job. And when you want primary care, you provide incredible incentives to move your people into a primary care provider who's paid on a subscription level, who's going to give your people the time of day, give them immediate access to really figure out what the problem is. And the first pillar that we haven't even talked about is what NUKA did such a great job about. Remember what I said when I said they told the doctor and the nurse what their primary job was?
Yes.
It wasn't to be a doctor. It was to be a coach. It was to be a friend. It was to get in relationship. So the first pillar is, for goodness sakes, offer your people a coach.
Yep.
And it doesn't have to be an expensive doctor that's going to be their coach. It can just be someone who's a guest at your table, who supports you in reaching your aspirations in life. And when you fall off the cliff, you've got access to a direct primary care provider who's going to pick up the phone any time or day. And if you need something beyond primary care, you send them to the best qualified providers. It's that simple. And you pay cash up front.
Yeah. That's
how you build healthcare, to spend half as much, to mirror the best healthcare system in the world, and to make and create immense loyalty.
Yeah. And I would imagine that coach is probably going to counsel, the folks that they're coaching, and tell them that it might not be the best lifestyle habit to, gorge yourself on Wendy's and McDonald's every day, and chug it down with a 12-pack of beer. And go through a carton of cigarettes a week.
Well, and let's address that, because you just brought up probably the most important element of an aspirational model. It's not about the coach telling the person that that's bad behavior. It's about the coach building a relationship with the person to figure out what their goals in life are, and to show them how, if they want to reach their aspirations, changing their smoking, changing their guzzling down, changing those things are going to help them reach what they want. People want to make the 3-point shot.
Right.
And so it's not about, here, I'm going to tell you what you should stop doing. It's about, let me help you as your coach reach the 3-point shot.
Yeah.
And I can tell you right now that if you'll cut out the gorging and the smoking, you're going to be a better athlete to make the 3-point shot. So one of the analogies that Dr. Eby uses that I love is, he says, okay, if you want to hit a target with a rock, you can throw that rock and hit that target almost every time. But if you're throwing a live bird at that target, that bird's going to go wherever they want to go as soon as they leave your hand. They're not going to go to that target. They're most likely going to go to the nest. So you put the target at the nest. If you want the bird to go to the target, put the target at the nest, which is why in an aspirational model, a coach's role is to build a relationship of trust to find out what the nest looks like for the person. What are that person's goals, dreams, bucket lists, and aspirations, and then support that person in reaching them. Have you ever heard of the book, The Dream Manager?
No.
Okay, this is such a good book. So it's a fictitious story about a CEO who's got 30 to 40% turnover. He cannot for his life of him figure out how he's going to cut back on this, create better retention. He comes up with this idea to hire a dream manager. And this dream manager's only job is to coach his employees on their personal dreams. Could be a hobby, could be a trip to Hawaii, could be buying a home, could be building a competitive employment opportunity that'll take them out of his employment. Could be a competitor they want to build. Doesn't matter to him. Your job as a dream manager is to coach my people in helping them reach their personal dreams. You're not here to coach them on how to be a better employee. This is about how they can reach their personal dreams. You familiar with the Go Giver book?
Yeah, I want to say yes, but I'm not sure.
So it's this whole principle that if you expect to give more than you expect to receive, you'll be wildly successful. So it basically applies this principle: be more invested in their personal dreams, and they'll be more invested in you. And so the dream manager, of course, all of his employees, the retention goes way up, the turnover goes way down. They want to stay with him because he's committed to their personal dreams. So when you think of the aspirational model of giving someone a coach who's going to help them reach their personal dreams via the employer's benefit healthcare package, you just gave everybody a dream manager to support them in reaching their personal dreams.
Yeah.
That's going to create even greater loyalty, which is the whole reason you're buying healthcare in the first place. I have a CEO client.
When was the NUKA
who not only
initiative?
What's that?
When was the NUKA initiative launched? What year?
It was back in the 1990s.
Back in the 1990s. And so this has been at work in the system now for 30 odd years.
30 years.
Right?
Yeah.
So I would imagine the story is much bigger, because if you're doing what you described, you're not just changing healthcare for people. You're changing people. You're changing a community. You're you're repainting the landscape essentially. So it would be fascinating to me to hear some of the stories of how the benefactors, the Native Americans that now switched over to this coaching hybrid system where your doctor is no longer your doctor, but they're a beloved guest that's sitting at your family table.
Yeah. Can I tell you a story?
Yeah, please.
So April Kyle, the CEO, she loves to tell the story about her son who's grown up in this new model. I mean, she's fairly young and she's pretty much grown up in this model. And she talked about one day she was taking her son, who I think about this time is maybe 4 or 5, and who has been familiar with this relationship-based primary care since he was born. And he says to his mom, "Mom, when we get to the doctor's office, I want to have a chat with I can't remember if they call him a behavioralist. They call all their patients customer owners. And I can't remember if it was the behavioral tech or whatever. It goes, I want to have a chat with Mark or whatever his name was, the behavioral tech." And she's like, "Oh, why is that?" And he says, "Mom, the rest of the kids my age are having sleepovers and I got to get out of this pull-up." And so when they got to the doctor's office, he says, "Yeah, I want to talk to Mark." And then he says, "Mom, can you let Mark and I talk alone? Like, can we just do this?" It's like this kid grew up in a healthcare system where he had such a relationship with Mark that something incredibly personal to him, like getting out of a pull-up, he was willing to have that conversation with Mark. And Mom, you walk out because I want to talk to Mark first by myself.
How old is this kid?
That's an amazing story.
How old is this kid?
Probably 4 or 5.
That's crazy. Well, all right. It's about time to get out of that pull-up, but to have the wherewithal to just tell Mom to chill out. Oh, I got to have a conversation with Mark. That's crazy.
Exactly.
That's crazy. That is
Which is why, as an entire population, they've moved from being in the low 5% of all health outcome scores to now some of the best because of that ongoing relationship and behavioral focus. They've literally changed lives. They've changed people. They've changed a legacy of abuse and addiction. I mean, they've had an incredible impact on one of the worst population healths in the world because of a model that's designed around relationships.
And so the federal government must be thrilled, right? They chop their costs, to smithereens, and so
and the federal healthcare system, I don't even know how they've reacted. All I know is that they've diverted. Now, keep in mind that what they give tribes towards healthcare is very, very little. So NUKA gets their funding source from both that and Medicare and all different, places where they get the funding. But if you take a look at everything they spend on their entire population per person and compare it to the average across this country, even with a more intense acute population, they're about half the cost.
Yeah, that's crazy. Because at the beginning of your story, you said that was kind of that was what prompted them, right? The government said, "Hey, if you think you could do better, then have at it." And they said, "Well, we think we could do better," and they sure did. They sure did.
And there's no better story to tell a CEO who's spending $14,000 per employee per year and say, "You know what? You can have confidence that you could be spending $7,000 and you could be creating far better loyalty amongst your employees by applying this aspirational model." That's a great story.
It's a phenomenal story. Now the pessimist in me wonders about, and I guess this is going to vary from organization to organization, but brokers, particularly big box brokers, the publicly traded ones and the large privately held brokerages, are so intertwined with the system, quote unquote. It's nearly impossible for them to break away and execute the changes that you're talking about, because they're
They're
they
beholden to the
they
system.
they would decimate their revenue, and so the leadership is just not going to allow that. It's just not. And so on the flip, I always wonder if I'm having a conversation with a CFO and I'm literally putting pallets of $100 bills stacked floor to ceiling on the desk of that CEO, on the floor of that office, and they're not inclined to be more inquisitive or make a move. I have to ask myself why. Either they don't believe in what I'm telling them that we can execute, and we have plenty of examples that, and references. Here you go. Or
Yep.
are they really that selfish that they might have to forego the courtside tickets to the game or the U.S. Open or the trip to the Masters or the trip to Pebble Beach? And so you speak with a lot of CEOs and CFOs. I don't want to believe that that's even possible, but is that at play? Because it just boggles my mind. Like, getting back to our original kind of conversation when we first started out, it doesn't make any sense that when you're talking to leadership about their biggest expense after payroll, that they are not more interested in solving this problem.
There are some of those who are just like, yeah, it's just too hard to believe. I like my front row tickets to the Jazz. But the majority of CEOs, and I'm using my book to get in front of and taking to lunch CEOs. I was at lunch last week with a CEO of a large employer here in Utah. And, his comment was, I've always known something was wrong. I've always figured there was something wrong with this whole thing.
Yeah.
But I've never been able to put my finger on it.
Mm-hmm.
And now when you make it this simple, that all I have to do is define what I want, measure to see if I'm getting it, and then aligning the system to work for me, it makes sense.
Yeah.
And he went right back and talked to his CFO and HR people and said, you know what? We need to have Darrell come in and talk to the whole group, because I've always known there was something wrong. It didn't feel right. I don't like the fact that it keeps going up. And yet I've not known where to put the finger.
Mm-hmm.
And it's like you align your internal team. And then in many cases, you have to fire your external team. Because if your broker or consultant is working for a big house that won't allow them to switch, you're better off just firing them and then bringing in someone like yourself or Dave Contorno, there's a whole host of Rosetta certified, advisors, or they're a part of the Ascend program, or part of Free Market Medical Association, or a part of ePower Benefits, or a part of the aspirational healthcare movement. There's so many out there that can help an employer, because they want to be aligned. They're willing to sign a fee-based contract where their bonuses are tied to the employer getting a higher level of loyalty or saving money. That's the alignment that only the CEO can do. You can't give that to the CFO. You can't give that to your HR. You have to take ownership for the fact that I'm the CEO. I'm going to decide what I want for the money I'm spending, and I'm going to align my internal and external team to help me get it.
Yeah.
I have to be the one that says that.
Yeah.
And most CEOs see that, and they respond well to that.
Yeah. No, I got to tell you, it's the hardest thing that I've ever tried to do in sales, and I'm a career sales professional, is displace an incumbent broker. And you could have these conversations and these stories and show people exhibits and give them references. At the end of the day, though, they're making a decision to fire an incumbent, and brokers are very good people persons. They're
building relationships with those key decision makers.
Correct. And it's difficult for them to fire someone who they know, like, love, and trust. And so I think I think what they must do is take a page from Drucker's book and inspect what they expect. Even if they love their broker, they owe it to their position, to their organization, to their people, to just do an audit every once in a while, have an independent third party, Health Rosetta, next gen advisor come in, pay them to do a study, and just see what's possible.
Well, and the most important data point, I mean, your current broker will tell you all about all kinds of data, all the gaps in care,
Yep.
all the spike claims. They'll tell you data till it's coming out your ears.
Yep.
But what they'll never tell you is whether your loyalty scores are going up.
Mm-hmm.
And there is no more important data for an employer to look at from year to year than the very data that's about the whole reason for why they buy healthcare.
Sure.
Their loyalty. If
Yep.
loyalty is the number one reason they're buying it, why is that the number one data point that's on there? That should be the dashboard for healthcare.
Yeah.
Is my healthcare benefit improving my loyalty? And if it's not, somebody ought to be held accountable for this.
Yeah, and they have to, that's a great point. They have to go back and ask that simple question. How are we doing? And I think they'd be
What do we want?
amazed at what they find. And right, what is the biggest asset in our organization, our people? What are they telling us that they want? And they have to start paying attention to that. So I'm doing a study now for a company in Memphis. They're a manufacturing company. And to their credit, they don't charge their employees a whole heck of a lot for the premiums. They foot the bill for most of that. But their deductibles, are starting at, I think on their high plan, probably $3,000 and then $5,000 for individuals. And what I say to them is these people are functionally uninsured because they can't afford, other than the primary, care visits, or if they have to go to a specialist, that might be a $30 or $75 copay. But beyond that, if, the shit hits the fan and they need a surgery, they're not going to be able to afford that $2,000 or $5,000 out-of-pocket expense.
Yeah.
Exactly. Yeah. And so this is what we're doing, to our people. And, conversation for another day, but I really think that our policy makers in D.C. are selling us down the river. They're hanging us out to dry. And not when I say us, I mean our fellow Americans, their family, their friends, their neighbors. We really have to do a better job of holding our politicians accountable, because I think that's a big piece of this problem. Well,
it is, but I think the most important thing a politician can do is just use their podium to educate employers that the healthcare system's pulling the wool over their eyes.
But
because in the end,
they're not going to
really
do that,
is
though.
The employer.
Darrell, they're getting paid. They're taking kickbacks in the way of campaign contributions, and it is correct. There are three lobbyists, pharmaceutical lobbyists, for every congressperson. That's a real number. So the problem is they're in their pockets, and so
they're not going to do it.
They're not going to do it.
I don't think it's the politicians that will fix healthcare. I think it's waking up business leaders.
Correct.
Because right now the environment exists where any business leader can create an option. Don't force everybody into a new system.
Yeah.
But there's no employer today that can't, in their own legal terms within their state, create an option for their employees where they can continue consuming healthcare like they always have,
right,
or consume healthcare in an aspirational model.
Right.
There's no reason why employers can't do that. There's no law that has to change.
Right.
There's no governor that needs to create a new edict. It exists today where every employer in this country can offer an option to their employees to either have an aspirational model, or what they've always consumed healthcare.
Yeah. So as we close here, I just want to give a shout out to Chris Deacon, who wrote this book, The Great American Healthcare Heist. A little less than halfway through it at this point, but it is an eye-opener, and really it talks about the good, the bad, and the ugly, and all of the players in this drama that's playing out. And Darrell, you reminded me that her dedication to this book was to Marshall Allen, who we lost tragically far too young a year or so ago. It might be 2 years at this point. He was the first guy. So Marshall Allen is an investigative journalist who really dedicated his life's mission to helping the little people and the underdog in their fight against healthcare systems and medical debt collectors going after them, and really was a voice for them. A remarkable human being, and a great loss in our circles, and really for our society. But Marshall Allen was one of the first guys that I heard. It might have been at the Ascend conference, where he said we're in a healthcare bubble, and he believed that we're at a tipping point, and this bubble is going to burst. So, what I'd love for you to for us to end with here, is your thought on that. Are we in a healthcare bubble, and where do you see this game playing out? Because part of the challenge that I have is it's a $5 trillion economy, and a lot of people think healthcare is not broken. It's running just fine the way that it is. And they're really incented to keep that train on the track. Correct. If you're a betting man, where do you see things going?
I have some very strong feelings about this. Having spent the last 12 years with business leaders, and having heard them say over and over and over, I hate this. This is my greatest frustration. There is an immense pressure in this country amongst the people who buy healthcare, the business leaders, the CEOs. There is an immense pressure amongst them to find an option to change. And although this new model that's getting lots of traction, and even Dave Chase mentioned a few days ago, it's a $30 billion industry. Well, that's less than 1% of the $5 trillion industry. So we have not hit the tipping point yet. But if we can keep growing this, popping this bubble, I believe that the pressure amongst business leaders out there across the country to find a solution, when this starts to get enough traction and enough evidence that everybody's like, oh, this is what everybody's doing, it will happen quickly. It only took 10 years back at the end of World War II for group health insurance to become locked in. It didn't even exist. And within 10 years, it became the major way that employees across the country had health care coverage. I think it'll take less than 10 years for this bubble to burst and for the majority of employers across the country to offer an aspirational healthcare type model like the one in NUKA. In fact, already through the Health Transformation Alliance, the largest employers in the country are rolling out an aspirational model. One of the largest brokerages is rolling out a whole new design this year to 50,000 employers that's around this model. There is a lot of things happening right now across this country to give this movement enough traction that we will burst the bubble.
Awesome. I think we'll leave it there. If folks want to find you, how do they find you?
Easiest way to find me is just go to LinkedIn, Darrell Moon, or Orient, ORRIANT.com, Orient.com.
And you do some public speaking, and you're available, for a chat if people are interested in reaching
Absolutely.
out. Awesome.
Yep, I respond to all of my emails. I respond to all the comments. So be happy to talk to anybody.
Darrell Moon, hey, it's been great spending some time with you. Thank you for educating me. Thank you for educating our audience.
Thank you, Rick.
Of course, until next time, folks, love always. Take care.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.